All right, so we are recording. Welcome. Thank you guys for joining us. We're going to have a couple minutes where we're going to let some of you join in and follow along here. Hope you all are having a good morning so far. We've got a really exciting presentation for you that we think you're really going to like. I mean, we hope so. All right. I'm going to let a couple more people join on. And it's 11:02 and we'll get started here in just a second. All right. For some reason all right. So 11:03, I'm going to go ahead and get started. Good morning, everyone. Welcome to our workshop webinar series. Today's topic is marketing and analytics tools for HIPAA compliancy. I know you're really excited to hear more about this because you are probably in the healthcare and marketing industry. So thank you for joining us. I'm Carolyn Chavetta, Business Development Manager for Anvil Analytics and Insights, and we're excited to have you join us for about the next hour or so. I'll be posting my contact information in the chat section of the webinar. So if you have any follow-up questions after our time is up, please don't hesitate to reach out. Don't worry about taking notes feverishly as well. We know that there are a lot of intricacies that can pop up, but we will be sending over the workshop recording to the email that you registered with. So a few housekeeping tips. As we work our way through the presentation, feel free to send over questions or comments. Use that Q&A button for specific questions that you want answered, and then use that chat section just for general chat back and forth with all of your other attendees. Side note, did you know that Anvil has a YouTube channel? That's right, we for sure have a YouTube channel. Our decision science team has been hard at work making short videos that guide you through all kinds of web analytic problems. So I'm also going to share that link in the chat section as well. So be sure that you're on the lookout for that. So let's meet your presenters. Jenny Bristow is the CEO of Anvil, and Mariquita Barbieri, Barbieri, there it is, Barbieri, is an attorney and principal for Carmody MacDonald. I practiced that beforehand and still messed it up. So I am so sorry, Mariquita. With that, I will go ahead and hand it over to Jenny. Jenny, take it away.
Perfect. Good morning, everyone. Thank you so much for joining us today. Mariquita and I joined forces to talk about the ways that marketers need to modify or bring in and include compliance and attorneys within their marketing campaigns for a variety of different topics. And HIPAA is something that is really not super exciting to talk about, but really, really, really important if you're in the healthcare space. Fines can be in the millions of dollars, and usually the fixes are pretty simple. So what we're going to try to do today is walk through what HIPAA compliance really means to you as a marketer, and how to view and understand your tools and the partners that you bring on board through the lens of HIPAA compliance to make sure that you're set up appropriately from the very beginning, or to fix any issues that you have out today. So we promise to try to make this topic as fun as possible. And so let's go ahead and jump in. So first of all, we're just going to have a couple of slides about who Anvil and who Mariquita are, just so you understand the lens at which we approach this topic. So Anvil Analytics and Insights was founded in 2015. I am 50% owner, and I'm the CEO. Joel Post, he's the COO and does all the operational management at Anvil. We're in Clayton, Missouri, and we have about 20 employees. And our big differentiator is that we're nerdy marketers. We're all about technology and analytics. One of our big areas of focus is healthcare. And so we do tons of work in the healthcare space. One of the first things that hospital systems and healthcare clients have us do whenever we come on board is help look at all of their marketing tools and make sure they're not ripe for a fine. And so we thought, why not actually create a webinar to allow people to understand some of the things that we look at and the lens at which we tackle this problem. So here we are. Our three core areas of focus are digital marketing and strategy, analytics and decision science, and web design and development. So we do all of this in-house, but again, everything's through the lens of measurement. I'm not going to go over all of this, but we do it all in-house. So love working with our healthcare clients. Mariquita Barbieri, so to get that point from Carolyn, go ahead and explain your background and the lens at which you're going to approach this topic.
Hey, great. Thank you. Good morning, everyone. And no worries on the name. I know it's a mouthful, so as long as it comes out with some flow, it's all good. It takes some practice. My family gave me every letter in the alphabet. As Jenny and Caroline said, I'm an attorney. I've been practicing for about 17 years in the corporate practice group. And my background also includes mergers and acquisitions, tax, and then this fun privacy aspect. I was the privacy counsel and e-commerce counsel for DuPont, which is what makes the fun mixture and why Jenny and I get to do these great presentations together to bring in that great analytic and that kind of e-commerce side in many industries, and now specifically with the healthcare side for HIPAA and high tech today. As Jenny said, I will not make privacy overly sexy. It is not the most exciting topic, but we try to have a good time with it nonetheless. So let's rock and roll.
Perfect. So today there are 4 key things we're going to discuss. First, we're going to talk about a checklist of questions to ask yourself about any new tool that you're considering. So we're going to try to make it really easy, give you a couple of core things to remember whenever you're digging in to a new tool or software within your marketing technology stack. We're actually going to talk about some of our favorite tools that offer HIPAA compliant settings and help you understand how to actually look at a tool, because we're going to share some direct links within our platform. We're going to talk about what to come, what to watch out for in the coming months with HIPAA changes. That's going to be all Mariquita for all of those slides. She really knows what's happening not only in 2020, but then also changes in light of COVID. A lot of things have happened in the last few months regarding HIPAA, and it's really important for marketers to stay up to date with that. And so with that, let's go ahead and jump in. So this is one of my favorite quotes. Through the lens of everything that we do here at Anvil. It's, if we have data, let's look at data. If all we have are opinions, let's go with mine. So this is one of the common reasons people come to Anvil in the first place for marketing, is because they are ready to start using data to drive their marketing decisions instead of opinions. And so one of the things that we see really often is people come to us and they say, we are super interested in doing machine learning. And we make them step back a little bit and we say, okay, well, machine learning is really exciting. But if you look at this marketing analytics maturity scale that we created, it's almost the very top step. So you really cannot jump directly into something as sexy as predictive modeling and machine learning until you tackle all of those foundational steps down below within the marketing maturity scale. So this is a great way that we've been able to set people's expectations for the work that they have to do to get to the point for something more exciting and technologically sophisticated to happen. All of the foundational steps have to do with different marketing technology tools, and that's where HIPAA compliance can really come into play. A lot of hospital organizations are excited to jump into personalization and machine learning and automation, but if you aren't sure that all of your technology platforms are safe and secure at the foundational level, then you can get into an issue where the exciting things that you turn on actually put you at a much, much, much greater risk for a HIPAA fine and compliance issues than if you didn't try to get into those exciting areas. So today what we're wanting to do is really step back and talk about those foundational pieces and make sure that you're ready to go. Moving up the journey on this scale, honestly, sometimes can take 2 to 3 years. So one thing that we tell marketers that are excited to get into analytics and insights and measurement is to really think about it as a marathon and not a sprint. So we try to help set very realistic targets of what can you accomplish this month, over the next 6 months, next year, and then what's your 2 to 3 year horizon and strategy based off where you want to be and how sophisticated your organization wants to be. And it really helps do that. So in order to do business intelligence and insights, you're going to have to collect a lot of data about your users. And usually people get super excited about all of the data their CRM and CMS system can collect and all the automations they can do, but it really isn't as easy as it sounds. Just because your platform is telling you that it can collect all of this user data regardless of what industry you're in, but specifically in healthcare, you really should pause and stop for a moment and then say, wait, which of these issues do I need to pay attention to make sure that I'm compliant? So there's domestic legislation, but there's also international legislation. So some of the general things that you need to be aware of are the GDPR, General Data Protection Regulation. This was big a few years ago and is still growing in importance for marketers to pay attention to. Started over in Europe, and it generally has to do with the amount of data that you collect and the way that you're disclosing that you're collecting that information. If you do any work with anyone over in Europe, you definitely need to be aware of GDPR, even if you are not trying to actually do commerce with them, but they come to your website, definitely could be an issue for you to pay attention to. We have the high-tech and HIPAA, which we're going to be talking about a little bit today, in the California Online Privacy Protection. California Online Privacy Protection is really taking some of that GDPR and pulling it into the US. Basically, anything that happens in California is going to happen to the entire United States. It's just a matter of time. So as a marketer, it's really good to pay attention to things that are happening internationally as well as locally, within your own jurisdictions, to make sure that your technologies grow with the regulations as they happen. But there are also industry concerns and changes that are happening that you need to be aware of. So for example, the Intelligent Tracking Prevention, ITP 2.1, 2, and 3, is changing the way that we're able to share tracking data between websites. So it used to be really easy as a marketer. We could be able to understand your browsing history and what brought you to us. And a lot of changes are happening as far as how much information can be shared depending on what browser you're using. Really can mess up your referral data. And again, this probably is going to get bigger and bigger over the next few years, so it's important to watch. There's also Google Analytics web and app tracking data, which fundamentally changes the way Google Analytics works. So instead of counting users per session and per visit, it actually changes where it's more interaction based, which really makes more sense as a marketer, but it fundamentally changes the way that we measure everything. So all of those reports and dashboards you're spending all of this time on, Google Analytics is about to turn it upside down and shake it. So really important to understand that analytics is not a one-time fix. You really have to be aware and follow the industry as it changes and grows, or things will begin breaking within your platform and you won't really understand why. So that's a big picture view of things you need to be aware of, and now we're going to focus specifically on HIPAA. So terminology one-on-one, we have all these different fun acronyms that we throw around within this presentation. I'm going to give you just a little bit of a primer. So HIPAA is Health Insurance Portability and Accountability Act. The P stands for portability and not privacy. I actually lost that at a trivia game with Mariquita about 4 years ago. So that was right when we were getting into HIPAA. We had quite a fun laugh about it. Well, she, I think, laughed at me, but that's okay. Business associate contract. So
you knew you were wrong the second you said it. You're like, wait a minute, it's supposed to be something different.
I did. I was like, whoa, stop, that's wrong. Too late though. We already lost it. Lost that round. Business associate contract, BAC. We're going to talk about what business associates are and why you need to be aware of them if you're working with any vendors, and when vendors might or might not qualify to have a BAC in place. And then PHI and PII, personal health information and personally identifiable information. That is the data you collect that can get you in trouble. So we're going to talk about examples of that in situations where clients we have worked with did not realize information was considered PHI or PII, and when we had to help them understand and change some of their protocols to make sure that data was safe and secure. So first of all, a business associate, I'm actually going to hand this slide over to Mariquita and have her talk about it because she can give a much better overview of the business associate world.
All right. Business associates are not medical facilities. Okay, so I think that's really the main thing to remember. It's not a hospital, it's not a doctor's office, but it's a company that provides services that could be mostly billing services. And those services are for healthcare billings, moving around those financial records for actually the services performed at the healthcare facility. And business associates can expand kind of beyond the very obvious answer of a billing type of agency into other companies that might be handling, touching, or processing those healthcare records, including electronic healthcare records and any sort of paper healthcare records. And what has happened is that what HIPAA and HITECH have done is said that both those healthcare facilities, sort of those direct hospitals, the direct medical facilities, and the business associates are held to the same standards and requirements that are set forth in HIPAA and HITECH, okay? HITECH, which we'll talk about in a little bit more detail going forward, but I just want to mention it here. In the same way that hospitals have to report security breaches, a breach of a medical record, a breach of that personal identifiable information, business associates must also report security breaches to covered entities. And those covered entities are the hospitals, are the medical facilities. So we didn't include that one definition up there, a little bit on purpose since we're focusing on a few other things today, but covered entities, I mean the covered entities that are subject to HIPAA and HITECH, those are the hospitals and the medical communities that you would logically think. And then these laws have expanded to include these business associates, those that are touching and processing medical records and personally identifiable information tied to those records. So they won't be held to the same standard. I'm going to pause there and just put it back to Jenny for 1 second in case she wants to add anything there. And then I can also that slide if you want. So let me know.
Perfect. So one thing that's really important to explain here is that Anvil, as a marketing agency that helps with analytics, we have never signed a business associate contract because we do not own and possess the data for our clients. So we do not actually ever take possession or manage directly any of that personal health information. So it's really important to be able to clarify and understand that, because many times we begin working with a hospital association or a hospital system, they immediately send us their business associate contract, and we have to explain, no, we actually are never going to own or hold that data. All we are doing is helping make sure that your systems are in place where everything's tracking correctly, but you will maintain possession of that data at all times. It will never come over to our desks. It will never be accessible to us because of the way that we're going to help you safeguard that data and information. And so it's really important to understand that just because somebody's helping you with your marketing initiative, that does not necessarily mean you need to have a business associate contract in place. So understanding when that flip switches and when they need to sign a contract because they are possessing and controlling that data versus when they're not is super important.
Yeah, that's a great point, Jenny. And there is a very clear exception that if you are an ancillary provider just working within a medical community, as Jenny's just described, there's a very clear exception that those types of companies are not business associates for the purposes of compliance with HIPAA and HITECH. Whew, what a relief, because no one really wants to be compliant with HIPAA and HITECH who is not really information and the personal identifiable information related to it. They are complex laws, so the world of non-medical people really aren't in line to say, yep, sign me up for HIPAA and HITECH. But you will get that request, as Jenny said, and the goal is not to respond with a knee-jerk of, oh, just sign it. The second you sign that, you're subject to HIPAA and HITECH as well.
Mm-hmm. Yeah. So it's very important both from the vendor's perspective and from the healthcare company's perspective to understand when it's important to have that in place or not. So the best rule of thumb I generally say whenever I'm working with clients is you don't want us to sign it because that means we have access to your data. You need to have safeguards in place where we never actually even see or touch your data. We're just having systems in place where we can help the flow of data so reporting is accurate. So that's a good rule of thumb to keep in mind. So 5 key checkpoints and things to keep in mind to make sure that your marketing initiatives are HIPAA compliant. We're going to have some fun case studies coming up to be able to make all of this a little bit more real for marketers. But again, we're going to be able to share this recording, so don't worry about scribbling these notes down. But first, key questions to ask is, do you have business associate agreements or contracts in place with all of your vendors when appropriate? And do they have agreements with everyone they outsource work to? So a great example would be if you are actually going to be using a mailer for all of your postcards, and they're actually going to be receiving all of your patient's information, like mailing address and other identifiable information, that's whenever you need to speak with an attorney to be able to see if that contract needs to be in place. So really going through all of your vendors and saying, what patient information do they have access to? And do we need to talk with our compliance team to get them under contract or not? Understanding and checking to see if you have a HIPAA compliant privacy policy on your website for visitors to see. So one of the most important things that is very often overlooked is making sure that you tell people how you're collecting their data, how you're using their data, and where their data will be stored, and how to get in touch with you for any questions that they may have about that. So that's a really easy thing to just pop in and think about every year. Go and check your privacy policy to make sure any new technology you're putting in place is still being mentioned and talked about in your privacy policy and that it's up to date, but definitely something to make sure is important to have there. Number 3, I have seen bite people every single time we start working with a new client. I'd say 4 out of 5 times this happens is we get brought in by a client and they start giving us access to Google Analytics, Google Ads, Facebook Ads, their CRM or their marketing automation platforms. And we see 3 prior agencies they no longer work with still having logins. That is a big no-no. It is very easy to forget to cut people's access off, but very, very, very important to remember to cut people's access off. So again, important thing to do, maybe even set a recurring calendar reminder for yourself, maybe the 1st of January and the 1st of June, log in, see who has access to these tools and ask yourself why. I'm going to go through some examples of how this can be a very, very big problem in a case study in the future. But basically for a good rule of thumb is nobody should have access to data unless they actively need that data. Something even as simple as Google Analytics, where surface level you might not think any PHI is, and I'll talk about that in a minute because it can actually house PHI. But having an old agency or vendor that you're no longer working with still have access to that information, if their account is breached for some reason, then whoever breaches their account will have access to all of your information. So it isn't even that you may think they have bad intentions. You just have to think about it from a security and privacy perspective, that it's very unwise to keep those accounts open. Number 4, do you have marketing tools that collect personal information? And if so, who has access to them? How secure are your passwords? And even who on your team has access to them? So think about all of the tools in your marketing stack that collect names, social security numbers, IP addresses, telephone numbers. License plate numbers isn't as big of a deal within the HIPAA world. We don't normally see primary care providers wanting your license plate. But even a primary area of concern for health of why you're making an appointment. All of this information is PHI, and it can be stored in different ways within platforms. And so making sure that you understand how your tools collect and store this information, and then who has access to it, super important. And then have you actually documented how electronic PHI moves throughout your organization? So a very important thing whenever you have new technology tools in your tech stack is to do a workflow. So who has access? Where does the data come in? What other tools integrate with that platform that might share or pull that data over? Because you need to understand the flow in case there's a breach and in case someone leaves your organization to cut their access off immediately and know what repercussions that may have. So it's pretty easy if you think about all of the customer or patient journeys that you may do whenever they're on your website and they have all these different interactions with your organization. Do the same thing with your tech stack. So whenever somebody goes through and they fill out the form, where's that data going? So they may fill out a new patient request form. What databases or tools does that form feed into? And why? Who has access to those? So it's really just taking your patient journey information and going another step and thinking about the behind the scenes that's happening. So we actually have a free HIPAA compliance survey on our website that is a great starting point. It just asks you, I think, 20 questions and throws up some red flags of areas you may want to think about. So it's a great starting point. If the things I'm saying right now are things that you're not actively talking about within your organization, a great starting point would be to take this quiz and it can red flag some areas of concern.
And just for everyone to know, with the follow-up today that you'll receive with the recording, I'll go ahead and throw that HIPAA compliancy survey on there so that you have full access to it and you can take that for yourselves.
Wonderful. Thank you, Carolyn. Perfect. So tips for HIPAA compliance. Here are 3 key areas of things that we've seen people get bitten on. So first is keeping your network secure. So again, we talked about following the flow of users over to the patient journey they're having on your website, then over to the data. Making sure that that data, you have one point or one person within your organization that really owns the access to those tech stacks can help from a governance perspective to make sure things are secure. Making sure your email marketing tool is HIPAA compliant. This is something that we see smaller organizations miss quite often. Larger organizations have these really sophisticated CRMs and marketing automation tools in place like Salesforce or Datorama or whatnot. Smaller organizations are the ones that are trying to use MailChimp or the smaller platforms, which isn't always a bad thing. You just need to make sure that you understand if you're on their HIPAA compliant version and what you need to do to make sure your platform is HIPAA compliant. And then be mindful before posting on social media. Again, this is something that we see larger and smaller organizations have hiccups on quite often, is forgetting that when you work there and you post something on social media, you may accidentally have something that is PHI in the background that's actually messing up the flow, or it could actually be a compliant issue. So you're sharing somebody's information accidentally just because of what's going on. So case studies. So let's talk about a couple of times that we have seen HIPAA compliance kind of implode. So both of these examples I'm going to share are situations with Anvil clients. Obviously, I'm not going to name names here, but Anvil clients where I have caught these issues before any fines were passed down. So first, call tracking. A national healthcare provider started working with us and wanted us to help them with a big marketing campaign, so a big nationwide patient acquisition campaign. We went through, and again, one of our normal onboarding activities is we just, as we're logging into each tool, we automatically check for compliance. We have a little checklist. Every member of the Anvil team has been trained on HIPAA compliance. So even Carolyn, even though she doesn't do hands-on work within it, she actually has gone through the training to understand HIPAA. So our team goes through all the different tools as we get access to them and make sure that everything's compliant. Well, this client was actually working with CallRail. So CallRail is a call tracking and attribution tool. What it does is it allows you to put a little piece of code on your website, and that code allows you to, it changes the number out so you can track where the new patients came from. Do they see you on Facebook? Did they see you on Google? Are they responding to an email? The CallRail is amazing for this purpose, but the client had it set up where the actual new patient phone calls are being recorded. So a patient would be calling in to make their first appointment, and they'd be saying, "Hi, yeah, this is Jenny. I want to make an appointment with Dr. So-and-so. Oh, yeah, here's my date of birth. Yep, here's my home address. Oh, the problem? Oh, I have this weird itch on my shoulder, and it won't go away. I don't know what's going on. Okay, Tuesday at 11? Awesome. See you then. Bye." That whole recording was on the platform for every single person who had a login to CallRail to see. And they had old agencies they weren't even working with anymore that had access to it. And there were thousands of recorded phone calls. So this was a huge potential violation issue. So the very first thing we did is we called CallRail. So CallRail actually has a HIPAA compliant version where they actually turn off some of this functionality and limit it based off of your accessibility within the platform and your role within the organization. So they transitioned this organization to a HIPAA compliant version. We killed all unnecessary logins, including our teams. So they tried to give everybody on my team a login. We killed all of them except for one. My director of decision science maintained a login just for reporting purposes. And then we had very strict tracking protocols of when he logged into the platform, made sure he had a secure password in place, and what he did whenever he logged into the platform, and everything was logged. So that saved them from being flagged. Of course, no issues ever popped up because we caught it way early in the process, but that's a good example of something that could have blown up and been a huge issue for them, and they didn't even realize it was a problem. Another example is email addresses. passed through query parameters in Google Analytics. That is a whole bunch of nerdy words thrown together, so I'm going to explain that. So Google Analytics is website tracking. It can track landing pages to your campaigns, different departments or specialties within your organizations. You can actually set up query parameters where the URL changes based off of what the user has done within your website, and then that can be passed through to the conversion. So for example, if they go through and visit 3 different pages, click on this content piece and then submit a form, all of that can be passed through into your CRM, so you know that that's what they've engaged with before submitting a conversion point. This client actually had it set up where the email address was in the query parameter. The bad thing about query parameters is they're visible. So they are actually within the URL where you can see it. And so anybody who actually can come in and can scrape your website information or can, access that information as a third party could scrape all those email addresses. And so it's a very old way to track information in Google Analytics. We do not use it hardly ever, except in ways where it is using short codes where only we know the definition of what that means. That way, if anybody does illegally access it, it won't be a privacy concern. But this person was basically publicly sharing all of the email addresses for anybody who was requesting new patient appointments. So again, fix that, totally change the structure of their Google Analytics, and they now are safe from any compliance issues. So these are just like little examples of tweaks and things that you should look out for and are really easy to fix. But if you aren't looking for them, then you don't know that they're a concern. So trusted tools. I'm not going to go over all of the tools here because, again, we have an entire blog post that literally lists out all the tools we use in the different areas of analytics and tracking. And within that blog post, the things that we did, I actually wrote this one, is I linked to the tools HIPAA compliant section of their website. So for example, within, let me think of one, within CallRail, they have a HIPAA compliant version, and I linked to that version in the blog post. You'll be able to understand the difference of that version and how to ask for it and know that you're getting the right tool. So 3 things you need to ask is, does the tool you want to use have a HIPAA compliant version? Do you need to modify your setup and integration to be HIPAA compliant? And then finally, again, who has access to your tools and why? So I'll let you actually go and read all the different tools and platforms later. Carolyn will include that in the follow-up notes, but hopefully this is a good starting point to get you going to understand different tweaks you can make within tools to make them safe. And with that, I'll hand it over to Mariquita.
Great. Now you know what to do, and now I'm going to go back a little bit and say what really is all of the mumbo jumbo behind HIPAA and high-tech and all of the acronyms that are laced throughout this presentation. More are coming. And I do want to also segue from Jenny's last part of her presentation and the case studies to say why it's important to have yourselves or work with a company to help you catch the errors and issues that happen behind the scenes of any website or sort of tools that are being used internally within a medical system. HIPAA violations are expensive. The penalties for noncompliance are based on the level of negligence that's assessed, and they can range from $100 to $50,000 per violation or per patient record. The maximum penalty is $1.5 million per year for violations of an identical provision. So in the case studies that Jenny shared with you, the list of thousands of names that she mentioned that were still on the site, still available, and still subject to a breach, if a breach had occurred, that would be a per record type of violation that would obviously add up really quickly. So as Jenny knows from working with me for a while, and Carolyn's getting used to it too, call us before, call an expert in this area before you start, before you do something to check, because even the investment that you make in this, while you will make an investment from a legal standpoint or from an analytics and insights type of expertise, that's going to be less expensive than the violations that can add up under HIPAA penalties. So with that, what is this mumbo jumbo? HIPAA's been in place since 1996, as you see here. I won't read this whole definition to you, and obviously you will have it. But HIPAA was the first regulation out. And I typically start my privacy training sessions with the statement that the United States doesn't care about privacy. Americans don't care about privacy. It's boring, admittedly, but I joke about it, and then people get a little huffy and puffy, and they're like, no, I'm not on this, I'm not on that, I watch my social security number. Good, good, good. Keep doing those things. I make the joke because unlike the European Union that has that GDPR that Jenny mentioned earlier, we do not have a comprehensive federal law for all data and all information. We have 4 areas regulated. The things that we care about have the laws that surround them. We care about our children, so we have the Children's Online Privacy Protection Act. We care about our money, so we've got the Graham-Leach-Bliley Act. We want to be left alone, so we have a whole host of FTC, Federal Trade Commission rules that let us opt out and opt in, and a lot of that's also laced inside HIPAA. And we care about our healthcare information. Thus, we have HIPAA, a set of extremely detailed regulations dealing with notices, breaches, and the consents to move information around, moving medical records around. That's why that word is portability and not privacy. Where are your records moving, and where do you give consent to move your records? Then, as technology has improved, high tech came into place. High tech is truly a replica of HIPAA, but it is truly for electronic records. So basically, they expanded the HIPAA compliance rules to just include the electronic records and actually push more of the electronic record usage and say this is all part of HIPAA. Please, process the information accordingly. So very similar regulations, one kind of relating to the original paper copies of medical records, and then a high tech brings in the new data, the new electronic records, and the way that we all really are doing business today. All right, let me see if I can get the slide to move as quickly as Jenny did. I think, Jenny, I might need you to still move that slide forward for me.
There you go.
Very much. So as Jenny mentioned, there's a lot of changes that are on the horizon for HIPAA. They really were teed up for 2020 because a lot of these started in 2019. The problem is COVID-19 interfered with everyone's year, including the regulators, to focus on HIPAA. Not surprisingly, regulations are already slow through the government. I'm sure you're all shocked to hear that. So we already have the delays of government movement, regulation, and board approval through many different systems in our US government. Such is the case anytime. Extra issues with COVID-19 this year. So there's very few changes that are likely going to happen that were originally scheduled to happen. I'll talk about those at the bottom of this slide. Instead, some other things automatically happened in light of COVID-19, but things that happened in 2019 and that were teed up for 2020 have not yet happened. So what's on the horizon? This slide covers it. We talked about opioid crises from 2017 to 2019. That conversation is still continuing. It is beneath the surface of COVID-19. So if we can all get through COVID-19, beneath the surface of the next topic in healthcare remains the opioid crisis that has been ongoing in our country and throughout the globe. So a lot of the changes were related to the opioid crisis. That being said, it was a lot of substance abuse type of changes that are teed up for change inside HIPAA and inside high tech, and how patients who have substance abuse disorders and abuse issues can get help and have their information be transferred from various facilities throughout their care. Other potential changes included the removal of aspects of HIPAA that just impede the ability of doctors and hospitals to coordinate the information. Most hospitals, I'm sure you all have seen this as well, now have an online portal. Their clients and patients can access that portal, and we're seeing doctors and medical staff be able to share that portal. What's happening still, though, is that inside care in the hospitals, directly from one to doctor two, if there's any disconnect in the hospital system or any disconnect truly within the hospital system, those are the communications that are not happening as quickly and efficiently as they should. And to some extent, those problems are happening because of HIPAA. So there is a group of people combing through HIPAA and trying to unhinge some of the restrictions that have been in place to make that flow of information faster, because life and technology and data analytics have made things move faster. And now HIPAA is a little bit outdated from 1996. I'll have you move forward in the next slide for me, Jenny. Thank you. So as I mentioned, it's a slow boat that has any changes in any government situation. It's been about 7 years since there was a major update to the HIPAA rules. And obviously those seem to be long overdue with kind of the slow movement in hospitals and other hospital facilities trying to communicate that information. We still think there's not going to be a whole lot of movement on these types of changes in 2020, but we did get some changes as a result of COVID-19. What happened as a result of COVID-19, I'll actually have you jump one more slide for me, Jenny. These kind of merge into each other so you can spend a little more time on that slide on your own. But the CARES Act, which of course you hear about almost daily, does align with some of the changes that were coming to be in light of 2020 for HIPAA. So maybe it helped cause that 7-year period to expedite itself. But in the meantime, we obviously are still mostly focused on getting through COVID-19. The great thing about the CARES Act that came to be for individuals suffering from substance abuse is that they needed to be ensured that their treatment and their ability to receive medical care were uninterrupted during this crisis. So the CARES Act was put in place and included how they thought of everything. It's not perfect, of course, but in the expedited time frame to put together the CARES Act, the HIPAA regulations were improved and expanded by allowing the ability of healthcare providers to share records of individuals who need that help without any extra consent. So the flow through of information in this particular area has improved substantially during COVID-19. And even you'll see as we talk further, in light of COVID-19, some of the enforcement of HIPAA has been relaxed to provide faster care. Next slide, please. I wish I had a little ding like they used to have. So what can happen now, and as Jenny has explained in the earlier, tips, tricks, and the things that you need to have in place to be compliant, consent is required in so many places to be compliant with HIPAA and with high tech. Those can be clicks, those can be signed documents at a medical facility. Those can be direct from a business associate for payment or otherwise. The entire system and from start to finish, from healthcare receipt to payment for it, is a string of consents along the way. What has happened is that they've noticed that those with substance abuse disorders are not fulfilling those consents correctly, or are sort of getting stuck in the system if they do not provide a fast enough consent. So targeting that group particularly has been an eye-opener for other types of movements during COVID-19, and that has allowed those with substance abuse disorder specifically to have a sort of one consent that flows all the way through from receipt of healthcare all the way to payment. That hasn't always been the case, and that is now the case in light of the CARES Act. So certainly a win for those needing that healthcare attention. And I think as a result of it, we're seeing medical facilities kind of report back and say, this type of broader consent is what we need in order to more easily provide expedited and timely healthcare. So the joy of this is that we're going to see, no, you're okay. The joy of this is that we're going to see a relaxed, and this kind of laughs at the American system again of how much do we care about our privacy. Well, we really do, because we really care about our healthcare records. So I think there's going to be a little bit of a catch-22 in how these broad consents for our substance abuse disorder patients, it's already flowing into non-substance disorder patients because of the immediate care that's needed for any severely diagnosed COVID-19 patient. Underlying conditions obviously are those at their core being impacted by COVID-19 as such, any medical history for those patients needs to flow faster because the time frame for COVID-19 to escalate for those patients is extraordinary. So we have seen now HIPAA requirements be relaxed, not changed as a result of COVID-19, only with respect to the substance abuse disorder patients. But we are noticing that there will likely be a lack of enforcement of HIPAA and all of those fines in the coming months and what has occurred in the past few months. And we'll see if that carries forward or whether there's going to be some real changes that change how the consents are giving in light of this. The catch-22 part of it, which isn't on your slide, is really one for discussion and thought, which is the diagnoses of COVID-19 across the board, from a disclosure standpoint for companies at work, for employers, for employees, and for those types of records. Obviously, employers are not business associates unless they're in that business, but they are not that with respect to their own employees. So this tracing of the disease, the tracing of the COVID-19 across our population has called into question some of the folks out there saying, well, wait a minute, isn't my personal medical information protected by HIPAA? And technically it is. So the disclosure of that information is truly a patient by patient case. And however that information is flowing, for reporting informations through testing centers and the like, resulting in a lot of contact from arguably, non-medical associations who are business associates, getting your information and contacting you about COVID-19 testing. So it'll be interesting to see how this shakes out by the end of the year or into 2021 as we hopefully see the end of COVID-19 cases and that those continue to stay diminished. So a little bit is still yet to come. Nonetheless, the CARES Act has done a great job in at least taking care of our SUD patients and also expanding and relaxing the current HIPAA enforcements so that we can get health care to the people who need it the most right now. Next slide. So during these emergency situations, which I've just mentioned, is just kind of a recap here of how these enforcements of compliance are going to be relaxed. We're seeing that already. And then there's another office that ties into the land of HIPAA and high tech, which is this Office of Civil Rights. So again, this ties into the comments that we hear of, isn't this diagnosis, isn't this test result my own personal information and my medical information to hold on to? The places where, again, Americans say, hey, we care about this as my personal information. So the Office of Civil Rights, regards that information as a civil right to each of us to manage that information. So they are also trying to develop ways that, like this Zoom call and the more video conferencing that we're doing, big rise in telehealth, which I'm sure you know. Obviously, these are new plans that are really, they started last year. I know they've improved already, even over the course of the last 6 months. Healthcare plans now include telehealth options. And the notices of enforcement have said, hey, you can do these 3 things, especially during a disease outbreak, to make sure that healthcare information is getting disclosed. So one is this, hey, we're allowing good faith telehealth remote communications. It does not have to be through a established telehealth platform that were parts of these insurance plans. They can be FaceTime, Skype, Zoom, Google Hangouts. What you cannot use is TikTok and Facebook and other types of public platforms where privacy professionals across the globe continually target Google and Facebook through their size and the volume of data that they receive. So again, we're really I'm seeing the allowance by the OCR of the use of all of the technology tools, not just those that are already tied into a hospital platform. And then number 2, if we're seeing good faith uses and disclosures of private information and the personal health information, that's actually allowing a flow of information without the consents. Again, this is a huge relaxation of the current rules of HIPAA to allow public health and health overseers to flow through information and get it to another hospital facility or to a medical facility as soon as possible. Again, this is tying to those underlying conditions. so that people can figure out how to address the symptoms and manage the situation and try to get that patient through the COVID-19 situation. And then generally, number 3, participation in operation of these community programs that you'll hear or know about, that if you have gotten a COVID-19 test, regardless of your result, you receive some information in the mail from a community of organizations that are managing that information and reaching out to anyone who's taken the test in order to help them through a further diagnosis or their symptoms, or to make sure that their case is being managed and controlled. So these are 3 new things that sound a little wishy-washy, a little bit on purpose to allow the flexibility during an epidemic and during this time frame. And those have automatically changed HIPAA for 2020 and HITECH for 2020, even though we're still slow to see official changes to all of the regulations.
And Mariquita, a question for you. When things like this go into place, as far as changes are concerned, is there a notification when those changes get rolled back, when they're changed again? And then when people are talking about fines or implementing, what sort of happened in the past versus maybe where we are a year from now, what can they expect as far as when they need to start transitioning back to maybe the older, more rigorous ways of, you know what I'm trying to say, of HIPAA?
Great question. And I think that the regulators would say as follows, which is all tying into the tips and the tools that you need to implement still for HIPAA. The regulators would say, hey, the HIPAA rules have not changed. So you better be in an aspirational situation, putting together the tools, enforcement, and monitoring mechanisms that we have always required. These did not suddenly go away as a result of COVID-19. What the regulators are saying is, even if you have those tools in place and you don't have time to perfectly obtain a consent or move information in accordance with HIPAA for now, we might let that pass, but it doesn't mean that we've changed the rules and that you don't go back to it. With respect to getting notice on this, great question. We'll probably do another one of these webinars so that we can update you. Because geeks like me and Jenny and the team at Anvil will be watching this. And we will give those updates as we see them. My guess is that as we hopefully see cases of COVID-19 continue to decline and diminish, hopefully in the coming months, that we will see them come back and say, that's all of the pandemic now. We're going back into a system where we are going to up enforcement again if we don't see compliance. That being said, there's a couple of slides that include places where we have already discussed, and they've discussed throughout 2019 and 2018, some of these rules inside HIPAA are too rigorous. Not too rigorous from a protection of your personal health information, but too rigorous from a consent standpoint. So I think that we will see things that have been working from the CARES Act dropped into official changes in HIPAA going forward. Enforcement might ramp up, but consents and requirements along the way might be changed as technology is probably changing for the better during this period.
I think that makes complete sense. Thank you for answering that. And then a question for you and Jenny to both weigh in on. If you could give 1 or 2 pieces of advice to a compliancy officer with the knowledge that both of you have, what would you suggest that they need to do in the next year? What are those maybe 1 or 2 things that are overlooked that really should be standing out to them, should be important to them right now?
You want me to, I'll go first, Jenny, and I'm gonna steal Jenny's thunder ahead of time because Jenny already gave a great answer to this, and I think it's monitoring and enforcement. So it's easy sometimes to say, okay, we're going to put these tools in place, but once those tools are in place, who's going back to check on them? Who's going back to update things? Who's going back to make sure logins and credentials are assigned to the appropriate person? Who's really done the analysis of the data behind the scenes, both historically and going forward, to see who has access, and if we're really collecting data and possessing data for a legitimate business purpose for a longer period of time than one would expect. When we do GDPR compliance work, That's often the place that says, let's go in and dive in behind the scenes to what you're coding and what your collection of data shows from your websites, from your systems, just like Jenny's company does. And this is the heart of the issue, because once we have the talented IT teams open up behind the scenes of these technology platforms, we see data as old as God or Buddha or Allah or whomever. It's old data. It could have been grabbed from a Facebook page when Facebook also had less compliance. And it is pretty amazing and mildly horrifying when companies open up their data behind the scenes to say, oh my goodness, we had no idea that we were storing that data. And that's the stuff that gets hacked. That's the stuff that gets breached. And that's the stuff that requires the hopeful dig down that you can convince your leadership to invest in, because it's boring and it's not exciting and it's not easy to see. But that's what both the United States laws and the European laws. Now, the United States laws are no slouch. Our Federal Trade Commission and through the HIPAA regulations, they say you better be working hard on this. It is important that you know where your data is flowing. So you better know where your data is flowing. You better be monitoring it, and you better be enforcing yourselves as best as you can, to say that we really do have a commitment to privacy and data security in our company.
I love that. Thank you, Mariquita. Jenny?
She took all of my answer. I was like, oh, I can add this. And then she circled around to it. The biggest thing we see whenever hospital systems or healthcare organizations begin to work with us is they do have a great compliance team within their own organization, but they're only focusing on the clinical side. Whenever the direct patient interactions are happening, they're kind of forgetting that the marketing team has that interaction. So really making sure that you get your compliance team involved as early as possible. One of the things that I have learned pretty early in my career is it's better to be friends with all of the attorneys and compliance teams within your organization earlier rather than later, because your relationship will not be as fun if it's later, because they're going to be trying to fix the things that you broke. So make friends with them early and often, and know that involving them in conversations is much easier than trying to catch them up later. And then really just making sure, like Mariquita said, there's governance in place to know what in the world's going on and that it's documented.
Love that. Thank you for that answer. Well, I think that is all of the questions that we have and all of the time. We are right at the very end of our time. So that's a wrap on today's webinar. Thank you, Jenny and Mariquita Barbieri. Nailed it. I've been saying it in my head for the last 5 minutes, for sharing all of the knowledge on HIPAA compliance. Keep an eye out on your inbox for the recording, and we hope that you'll check out future webinars. We have a really great one on building effective reports and custom data in Google Analytics with our Director of Data Science, Brett Lohmeyer, coming up in the rest of August and September, so be on the lookout for that. And then I'll be sure to supply the links that Jenny provided during the presentation, so that you guys can all have access to some of those HIPAA compliant tools that we absolutely love and support. So with that, we thank you all for being here, and we hope that you have a great afternoon. Bye, everybody.
Thank you.